Well, of course, we cannot talk about digital health without talking about decision support. And we have a very interesting guest here who's worked a lot with decision support. Could you introduce yourself to the public?
Yes, my name is Björn Söderberg, and I'm here for the company My Health 24/7. And what we are working is to support the population, how they can stay healthy also outside the hospitals.
We talked about different types of decision support. Could you also tell the people a bit about the different types of decision support?
Yes, because if people hear about decision support, they are a little bit scared. But normally we say it like this, that you have 3 generations. And if you hold this one for me, please.
Sure.
Then you have the first generation where you have a decision tree. So you can see you're a male, you're that old, and you have this kind of symptoms, and maybe you have this one. The second one is where you have the generation 2 system, and that is where you can combine your living sensor with maybe one disease. And then you have the last, and then generation number 3, when you have an interaction between the patient with the current condition, and you can also have personalized medicine, and that is what we are working with.
Just for also the public who have a vague idea about decision support, what is the purpose of having decision support? I mean, what are the benefits for both the healthcare providers and the patients when they have decision support?
Yes, I can take an example because we are also working with Infomed and NHS in England, and they had the challenge that a lot of people during evenings and weekends went to the emergency, and of course the staffing for the emergency was not that good during evenings and then they would like to create a solution so they can have the patient where the hospital also have the right staffing. So then they started to create this solution with a system called Symptom Checker, where you can start to fill in all kind of symptom, and you will also have some response. And if it's serious, then you automatically will be hooked up into a nurse that can guide you into the system. And today in England they have between 38,000 and 40,000 hits every 24 hours.
So are you operating only in England, or are you operating in other places?
No, what we are working with to implement this solution in Scandinavia and the Baltics.
Okay, and since you're comparing England now to Scandinavia, what are the differences between the market here and there?
There are, of course, a lot of difference. The population, they have 40 million and we have just 9. But and also the healthcare system, if you see it here in Sweden, is very fragmented. So it's a lot of stakeholders that you have to be able to cooperate with.
And what are the reasons for these fragmentations? And if you could just summarize some of the reasons of these fragmentations and how to possibly solve them, because it's definitely a problem that has to be overcome.
Yes, it is, and since there is also election in Sweden, it's a little bit political sensitive.
Yeah.
But from my opinion, it needs to be a responsibility from a national level, because that's the only solution to have some order of it. And of course, then you also to have a reimbursement system, so the players will get paid for it. Otherwise, you will not have anything.
So finally, what are your impressions so far about Digital Health Days?
It has been very interesting. I would say it's 3 reasons why I'm here. First of all, to see what's going on, and also to be able to take the solutions from other parts in the world to see how we can implement them here in Scandinavia.
Well, good luck, and I'm really happy that you took time to be interviewed here, and see you next year probably.
Yes, and then it will be even bigger.
Yep.
Thank you very much.
Hopefully. Thanks a lot.